Ladies and gentlemen, I will be doing a presentation and our study topic is spatial analysis using GIS and outbreak current analysis of COVID-19 in Bataan. And the presenter will be myself, Handia Nicolong Kinko, Robert Jun Tagle, Divine Grace Mamaril, Rachel Esconde, and Kathleen Faith Quanson. This video presentation includes the introduction slash background of the study, methodology, findings and analysis, and conclusion. As I've said before, the topic is all about spatial analysis using GIS and outbreak trend analysis of COVID-19 in Bataan. And as such, according to the World Health Organization, has declared a state of international public health emergency on January 30, 2020, and later declared a pandemic in March, the outbreak of COVID-19 have caused thousands of deaths around the world, including the Philippines. Given its high spread and number of fatalities increased worldwide, the disease investigation of the outbreak is essential and urgent. The prevalence of COVID-19 cases has produced a severe economic condition and needed an immediate action by the government to intensify the response and in mitigating the spread of disease to save lives. Given the problem, the rapid spread of COVID-19 caused a significant rise in total cases in the province of Bataan. Difficulty in providing awareness is crucial, particularly in pandemics like this. Detecting, analyzing, and responding to infectious diseases need a better perception of the significance and rapidity of outbreaks to execute oversight, prevention, and surveillance measures. Our solution is by providing a COVID-19 map using GIS and visualizing and analyzing the temporal evolution of the disease as grounds to formulate strategies in mitigating the spread. The study will be beneficial to the residents. Due to the high risk brought by the COVID-19, this study provides residents reliable and accessible information, and for them to understand the outbreak, we provided community awareness and updates. The local government. The study will provide the local government effective grounds for evaluating and assessing the geographic sustainability of certain locations in the province, which results to mitigate the spread of disease. For understanding the temporal change, to formulate potential countermeasure scenarios for implementation. And lastly, for the future researchers. The maps developed for the study will serve as a guide for future researchers in terms of GIS techniques, frameworks, and analyses work out from a different perspective and establishing a system for solving problems in the correlation of the disease.
The main objective of our study is to create an ideal map for the province of Bataan that will help understand how an epidemic occurs over time as basis for developing strategies to mitigate the disease spread. After that, here is the possible outcomes where the COVID-19 map could be used in a good manner regarding diversity purposes, and that is to, first, to determine the places with the highest risk in increase the COVID-19 cases in the province of Bataan. Second, to give accurate public information with available data sets showing the temporal evolution of COVID-19 about the current situation in Bataan. And last but not the least, to provide the provincial government of Bataan a basis in evaluating and assessing potential countermeasures for possible scenarios and in decision-making, social engagement, public response for resilience and dissemination of information in the community.
For our methodology, we're able to obtain the data sets of COVID-19 cases in Bataan from the Provincial Health Office. The data sets given were from the month of March to October. The graph shows that September had the highest number of confirmed cases, wherein 793 cases came from the municipality of Maribeles, and a total of 1,339 cases in the province of Bataan. This month also got the highest number of 1,157 recovered cases. On the other hand, a total of 53 death cases were recorded from March to October. Given the confirmed, recovered, and death cases, we're able to represent and visualize the high risk of the disease and generate a map that was carried out using the QGIS version 3.16. Based on the figure, it shows the paradigm and concept in creating the COVID-19 map that includes the GIS tool used for digitizing and editing the data.
Findings and analysis. So for our findings, the shown map is a cumulative total confirmed cases of COVID-19 in Bataan, which shows the temporal evolution in the different geographical areas of Bataan. As the cases increases in a certain area, the darker the color becomes, as well as shown in the cumulative total recovered and death cases. It also shows which area got the high-risk situation of outbreak over a certain month. That can guide the local government as well as the individual to track and identify the effective response to emergencies, including the transmission of infection. The results shows the COVID-19 map were able to provide framework for monitoring and mitigating disease.
Our study concludes that the results shown in the COVID-19 map of Bataan will serve as an optimal basis for identifying the outbreak and a model of potential countermeasure scenarios for implementation. It is a relevant tool for the dissemination of information on COVID-19 and assist the government in decision-making through evaluating the impacts of possible interventions. It also essential to discuss the difficulties from an interdisciplinary perspective in combating COVID-19. With the help of GIS tools, it empowers modern civil engineers in creating a new data method that can be of help in preparing and managing potential outbreaks as they illustrate and represent civilization's current situation in a modernized way.